I'd like to welcome all of you here today, as well as our guest speaker. I have the pleasure and the opportunity to conduct a one-on-one interview on professionalism in the dental office environment today with Dr. Ben Philiphs. Thank you, Dr. Philiphs, for being and meeting with me here today, especially during your busy schedule. We look forward to hearing about your insights, experiences in regards to professionalism as it relates in a dental office environment, particularly in regards to teamwork, work ethics, looking at workplace effectiveness and efficiency, teamwork, communication, and conflict management. I have just a few questions for you today in regards to professionalism in a workplace environment. And please feel free to share any further insights or your own experiences that you would like as we continue this discussion. So thank you for coming and meeting with me today. Dr. Philiphs, what are your general professionalism expectations overall within an office in regards to if it was a dental health professional, no matter if it was an assistant or a hygienist?
So professionalism is a difficult concept sometimes to define. It was one of the questions that I was asked in my interview for dental school, define professionalism, and everyone gives a different answer for that. But I think the real professionalism, I think, is fairly equivalent across lots of different fields. In any business or any kind of setting, whether it be clinical or professional, and that it's important to be positive even when things are difficult, and to maintain a good attitude and to display to your patients or customers, depending on where you're working, that sense of confidence and attitude, so that they feel that they're in good hands and that they feel that they are taken care of well.
So I think I'm hearing you say, Dr. Philiphs, that professionalism really evolves around a good attitude.
Attitude is very important, probably the most important thing, because even if things don't go well, or patients are having a hard time, or you're having a rough time with something, as long as you keep positive attitude and you keep going, it'll all work out eventually in the end.
So you would say that attitude is both in our verbal and our non-verbal.
Oh, yeah. Body language is important too. You know, you can be really positive in the things you're saying, but if you're huffing and puffing and showing frustration, you know, that people read that, and that can definitely make them feel uncomfortable. So I think that, you know, if you have a set of standards that you feel are important to display to a patient, that you remain consistent with that regardless of the scenario. And there are going to be lots of times when patients are happy and polite and easy to work with, and it's pretty easy to be that way. But there are lots of times when patients are not happy or even not very polite, or they're very anxious or upset, and they have a whole set of things that they bring with them to these appointments, subconsciously and consciously, that we have no idea about based upon their past experiences. So it's important as professionals for us to understand that may be occurring, and to try to not let that affect the way that you react and work with them or towards them. Because
would you also say, Dr. Philiphs, another professional trait or characteristic that you look for in your employees is flexibility?
Yeah, flexibility is important. That goes along, I think, with having a good attitude, because you can't have a good attitude all the time. Sometimes you have to, you know, hide your frustration or your feelings if you feel like you've been made to feel uncomfortable, depending on the situation, of course. But oftentimes you have to be flexible in that, and you have to be willing to work with a patient who...
So what have been some experiences in your professional history that have made an employee or a team member probably most valuable to you?
I think when things get stressful, we're very busy, if something happens that puts us behind, and you have multiple emergencies you're trying to deal with, and a staff member will step up and, you know, go and get the patient, or take an x-ray, or do something that you didn't necessarily ask them to do, but I think if they think about it hard enough, they can probably figure out how they can help. And so that, again, goes back to that attitude, being positive and wanting to be part of the team and help everybody as best as you can. and also trying to take that extra, effort to help a patient who might be a little uncomfortable or anxious.
Okay, what about unprofessional experiences that you've had to manage yourself with maybe staff that you've worked with, or maybe even some with your peers where you were in dental school?
So, as far as the unprofessional behavior goes, I think it's difficult now because there is a whole other set of distractions that are occurring in our society and our world that we didn't have before. I remember as a kid going to baseball practice and, my mom giving me 2 dimes so I could call home when it was time to come home from practice. And now we show a kid a payphone, he didn't know what that is. And I'm not that old, but old enough to remember that. I also remember phone ringing and you picking it up not knowing who it was going to be. And, or someone calling and you had to leave a message on their answering machine. So it's different now. We have smartphones, we have Apple watches, we have all kinds of stuff that you're constantly connected with stuff. And I think it's important to not be visibly using those things when you're in a professional environment. The watch is different in that you just glance at it perhaps, but at the same time it's not really it's a distraction. And I actually don't have an Apple Watch for that reason, because I know if I had one it'd be going off all the time and I'd be looking at it, and I don't want to do that. So I stick with the phone. I just put it in my operatory and in my office. I leave it in there, and when I get a break, if I need to, I'll go back and check it, whatever I need to do. If I have an important call that I'm expecting, that's business related, or then sometimes I'll keep it in my pocket, but the ringer's always off, it's always quiet. So I think that a lot of unprofessional behavior that we see now revolves around people being distracted with the technology that we have. So it's important to be mindful of that, and that people are watching and they pay attention, that kind of thing. I think social interactions, in a dental office between staff can be a tricky one too, because there are a lot of conflicts that can happen, and they can be petty, they can be legitimate, but in the end, it's a relatively small group of people working very closely together, and people can not get along with each other. It can happen in your own class that you're in right now. The other people in your class, some people you get along with, some you might not. But regardless, you're still with those people for the next, few years or however long you're in the program for, and nothing's going to change that. So it's important to try to, get along and find some common ground. And as a practice owner, and as managing my practice, that's something that is something that all practice owners have to deal with, and office managers, is the interactions between the staff, and it makes it hard for those managing to deal with when there are issues that are occurring. So it's important to have a good attitude and to understand where people might be coming from. But I think, in my experience and speaking to my colleagues, the majority of the professional issues that occur in office have to do with the interactions between the staff and whatever issues they may have with each other, as well as the use of technology, social media, phones, texting, things like that, and if it's being inappropriately utilized at the wrong time, in the wrong place, for the wrong means.
So I think what I'm understanding you say, Dr. Philiphs, is utilizing technology to benefit the patients in the office through digital radiography, patient education purposes. But what professional guidance do you give to your staff members about the use of social media, like the presence of cell phones or Apple Watches or iPads?
I feel that as far as social media goes, it's important that they understand that obviously you don't discuss a patient or anything that really happened at the office on your social media, because even if you have a hard day, you don't go on and go on your Facebook status, had a horrible day, can't believe this person did that or this or that, and it's it's unprofessional, very unprofessional, and it's inappropriate to talk about what happened during the day, because we all have bad days and stuff, and it's I don't think you'd probably find an anesthesiologist go on and say, oh, what a horrible day, my patient died today, or something like that. It sounds horrible, it sounds really inappropriate, and while it's much less significant, the consequences of the negative outcomes of what we do, it's still the same principle that you really should talk about that stuff outside of the office. It needs to stay in the office, and it's not appropriate to put it out there for everyone to see. And so as far as that goes, I think that's probably really important not to discuss it. And as far as the other parts of technology, we use a lot of technology in our office. We text patients to let them know when their appointments are. You know, they obviously have a website. We have lots of other things that we use. But I think for staff using their technology, there isn't really an appropriate usage of personal electronic devices in a professional setting. That's something to be done on a break, in the back room, in the employee room, on lunch. But as far as like in the operatory, you know, it's probably not a good thing to do. With the exception of when I show my patients pictures of fish I might have caught, if we get talking about it, trying to find common ground and make them more comfortable. But I'm not gonna, you know, go look at my Facebook page while the patient's sitting in the chair right next to me, or take a call or something like that.